there's a lot of misinformation out there, and there's also a lot of questions that are sometimes unbelievably unique to our work sites. And even though in some places we don't have all the questions answered yet, we wanted to be able to bring people together, hear the questions specifically around healthcare, and bring on experts that can answer the question. And also, our organization has been driving for a very long time to offer services to our members. And so we're excited about the launching of telemedicine, which we think, especially with what's going on right now with COVID-19, is a unique service that will be helpful to our members. So our response as a union to this crisis has really been fourfold. We wanted to start off by trying to keep our membership safe and informed during the crisis. We wanted to try to keep our members employed and or receiving pay during the crisis, and then we wanted to prepare for what comes next. We don't know how long this will last. We're in this in-between period where we're still trying to figure it out collectively along with the union, the employers, and our communities. But as a union, our mandate is to make sure on our members' behalf how we're preparing to deal with this crisis for the long haul. But we also need to push for changes that ensure that something like this never happens again, whether it be a pandemic or some other health crisis. We have to make sure that public services are delivered in the best way possible and that the people that are delivering them are actually safe. So we have with us tonight 4 guests, and I want to thank them for being on. One is Martha Baker, the president of SEIU Local 1991, Steve Sellers, Steve Utley, and Suhail Nanji, who is with Health Alliance Network, who created telemedicine. And so what I'm going to do, we have some questions, and we're going to get to that a little bit later, but I thought it made a lot of sense to have Martha Baker, who is a nurse and has been a nurse for a very long time, to actually come on, talk about what's actually truly going on with COVID-19, and then take some questions. So before we go to Martha, I just want to introduce her. Martha is the president of Healthcare Local 1991, which represents 5,600 nurses, doctors, and healthcare professionals at Jackson Health System. Martha is the founding nurse manager of the Trauma Intensive Care Unit at Jackson Memorial Hospital, the largest public hospital in the nation. She's also the chair of the national 80,000-member SEIU Nurse Alliance, and she's now the president of SEIU Florida State Council. She's been an advocate on a wide range of patient care issues at the local and national level for her unique perspective as an ICU nurse and as a labor movement leader. She has testified before Congress on numerous occasions, and I want to say I and our members are deeply thankful that you took time out of your busy schedule to come and spend some time with us and tell us about COVID-19 and answer questions. So I'm going to ask the first question and just allow you to take the floor. What is COVID-19, Martha? What is actually fact versus fiction? And what do our members need to do to mitigate the damage? And and not only just for our members who are public sector workers, your members are public sector workers as well, what are the challenges that they are facing as healthcare workers?
All right. Well, thank you, Alfonso, and thank you for your leadership and your team to pull this together. And I know the last time we met some of your members at our office, and they're all wonderful, and I'm sure the several hundred on this call are working hard every day. And I'd say the public sector workers are the ones who run in to work while others are being told to isolate at home. So hats off to all public workers. And I know we've got a lot of challenges. In Miami-Dade, we're talking about the bus drivers and, not just healthcare workers are putting themselves at risk, the workers in the grocery stores, et cetera. So hats off to all of the employees in this country who are continuing to go to work to deliver such important services. Obviously, I'm a nurse and proud of our members at Jackson Health System that we have a mission to deliver a single high standard of care regardless of anybody's ability to pay at Jackson, one of the largest public hospitals in this country. And I'm proud of our members that they're going in every day, leaving their families at home, coming home and at risk of infecting. But this COVID-19 is a coronavirus. There's several coronaviruses. We've tested for a few of them in the past. This particular strain is unique. We've never seen it. We're just learning about it across the globe. Obviously, I think we had a president that disregarded this, and we got a couple months behind. But we're where we are and we got to go from here. But COVID-19 is a virus. It seems to be much smaller in molecular size than most. 2 microns is what I'm told, and that's pretty small. And that's why there was such confusion about whether is it airborne, is it droplet. Seems to be everyone's agreeing it's droplet, which is good. Tuberculosis is the only airborne mycobacterium that we know of today, thank God, that can, would float in the air, and if you breathe it, you get sick. So this at least is droplet, like the common cold and like any other virus we know, that when you sneeze or cough and the germs go out there, if you're within 3 to 6 feet, you may catch it. But that's why we're spacing ourselves 3 to 6 feet, hopefully. And the risk is really when you sneeze in your hand and then you touch something with that hand, you're contaminating whatever you touched. If it's a doorknob, if it's a computer, if it's a cell phone, then you go home and your child picks up your cell phone, and then your child gets, this bacteria seems to be able to live a long time on a surface, which is a scary part. And that's why it's so important. The best things we can do are, when we can, socially kind of distance ourselves, quarantine ourselves to our homes. No restaurants are, open anymore. The beaches, the concerts, everything is closed down, and that's smart. And then we have to wash our hands and wipe surfaces. And you may not have it, but if you go to work and touch a surface with somebody that does, you could take it, to yourself or to your home or to your friends. They're suggesting that masks are actually a good idea. It doesn't have to be that expensive N95 mask that will filter out tuberculosis. The regular surgical mask, even a bandana across your mouth and nose, so that somebody doesn't cough and some of their spray lands on your mouth or nose or eyes. So anything that prevents, protecting your face. Your face is the entry point. It's got to hit one of your mucous membranes. Usually it's your eyes. You rub your eyes. And we as human beings have to learn how to not touch our face. Whatever we get on our hands can be filthy. But as long as we wash them and, don't rub our face, we can stay safe. So you can have COVID-19 on your feet, on your hands. If you don't touch your eyes, your nose, or your mouth, you're not going to get it. Now, if you touch something like hold your child when you go home, and then your child touches your nose and your face, your eyes, they could give it to you that way. So let's be very careful about extremely, frequent hand washing, especially these days. Alfonso, I think I know some of your members are bus drivers, and they're at risk. It's hard to socially distance, and you got to be extremely careful about somebody touching, your spot, your shoulders, your, the rails on the back of the seats. So you touch that, you're at risk. So you have to really wash and wipe surfaces. And people are kind of running out of these. At the hospital, we have this brand called Cavi Wipe. Other people have other kinds of, little towel cloths that can, come in a container and you can clean surfaces. But we shouldn't freak out if we run out of those or if they're too expensive. Hot, soapy, bleachy water works fine. Obviously, you have to be careful where you put the bleach. You don't want your kids running into bleach. But there's a lot of alternatives to cleaning a surface, your doorknobs, your computers, your cell phones, your hands. If we can really socially kind of distance ourselves and lock ourselves into our, small circle of family, and we can wash our hands, we can see this disease not get spread. What I think most of the countries across this globe that did well early on, and South Korea was one of the best, and apparently they learned this back when there was MERS and SARS and all these other viruses. They really locked down. They tested early. That's one thing we haven't done. We don't know where the hot spots are, really. We haven't tested thoroughly. Our governor thinks there's only South Florida, but I would argue we just haven't tested. And if, so people could have it, 90% of people are asymptomatic that have it. So, you can still spread it while you're asymptomatic. So don't be fooled that just because you don't have a cough or a sneeze or a headache or any one of those symptoms that you couldn't be passing it on to someone else. And that's where we get behind the 8 ball. We didn't test early. Broadly and early is the best way to test. And then see where the hot spots are. In Florida, it might have shown us it was Dade and Broward. And then we should have locked down Dade and Broward, in February, not in March. And maybe we could have stopped it. But, we're where we are, and we've got to fight it from here. So we need to just, wash hands really well. Think about everybody's touching. Don't touch your face. Don't rub your eyes. And we need each other's help on that. That's hard to do. See somebody rubbing their eyes, tell them, hey, don't rub your eyes, man. That's how you get it. Help each other out because we got, naturally we touch our faces a lot. When you start looking at it, you'll see it. But, it's not a mystery virus that is kind of different than any other. It's looking a lot like every other one we've known. It's just unique. It does seem to be highly contagious, and it does seem to live a lot longer on surfaces than most other bacteria, usually 4 hours, and it dies on its own. This, they're saying, can live several hours to several days on a surface. So you really have to wipe surfaces down. That's kind of what COVID-19 is, I think. If that feels like that's enough, I can stop there. If you want me to keep going.
I think it would be helpful because, people know that they're in the same union as nurses and healthcare workers and doctors. But can you talk a little bit about what healthcare workers are facing on a day-to-day basis? They're on the front lines of fighting this virus, and you actually had a tragedy within your union family. One of your members actually died from this. Can you talk a little bit about the threat that they're under and what they're dealing with and kind of what their needs are?
Sure, yeah. And it's, I think like when we had 9/11 and firefighters ran into that building while people were running out, it's kind of what nurses, doctors, and other healthcare workers do at the hospital, especially at a time like this. And, too often they think more about what others need than themselves. And, we had one of our ICU nurses, her name was Celi Buendia, and she was working on Monday, and she was working on Tuesday, and she died on Friday. So they did test her, and she was positive. She happened to be working in the surgical ICU, which supposedly had no COVID-19 patients. Jackson has about 5 adult ICUs at Jackson Memorial, and we've been putting our COVID patients into 2 units, the medical intensive care and another branch of the medical intensive care on South Wing 8. So we've got a trauma ICU, we've got a neurosurge ICU, and a CCU, and this a surgical ICU. The problem is we have never tested broadly, so we don't know who has it. And in this case, a patient was there. No one knew that they should expect that he was COVID positive. Finally, someone had tried to test him, and indeed he was positive, and they ended up having to test like 20 nurses who took care of that patient that turned out to be positive, that we had no clue, was in there for a totally different reason. So that's the scary part. I mean, it's scary everywhere in there right now. The doctors and nurses and healthcare professionals working in the emergency room, they know they're like head to toe gowned, covered, and hope they don't, you take your gloves off wrong, you can contaminate yourself. If you didn't put your gown on right, you can contaminate yourself. So you got to be like perfect for 12-hour shift, 3 and 4 days a week. And that's a lot of stress, knowing that the patients coming in there are coming in there for respiratory complaints. So chances are, 50% of them have it. But the other scary part about that is even when you're not working in units where it's COVID, the public has this. Your coworkers have this, and we don't know it. We haven't tested. So the safest thing to do is to treat everyone like they have it. And this country doesn't have the capacity to even test if we wanted to. We don't have enough tests. You heard Montana was trying to get, they don't even have it in Montana. There's not even a test available. We're testing about 100 people a day at Jackson. That's all our technology will let us do. There's some people from Germany saying they have a way to test 1,000 people a day. I think I heard today on the news there was a test being developed that would result in 5 minutes. You know, it's taken sometimes 5 to 7 days to get the result. Can you imagine? You're exposed to a patient. They're telling you to come to work if you don't have any symptoms. Everybody's got a mask on in the hospital. Everybody's got gloves on. But saying, you know, hang out with us and take care of patients for 7 days while we figure out if you were positive or negative. And, you know, thank God 90% are turning out to be negative. But obviously in Sally's case, she was our first one down, and I pray she's our last one. But the reality of that is probably going to be skinny. This is expected to get worse before it gets better. They talk about a peak and a curve where Italy went in 5 days, I think from February 25th to like March 3rd or something. They went from needing 100 ventilators to needing 800 ventilators. You know, and you've heard of New York, they're sharing a ventilator, one ventilator with 2 different patients. I've been in critical care all my life, and I've never heard of that happening. You know, just amazing things we're going to have to deal with. As Alfonso said, none of us, this is totally uncharted territory. We've never had to experience this, thank God. We've got to find a way to get through this, and I think the way we do it, thank God, we all have a union, and we have the right to be in conversations with our employers to make it as safe as possible. We have the right to negotiate safety and insist on safety for our employees and our members, and, you know, get through this. At the same time, a lot of us going to work when others aren't. You know, we've got a job to do, and we've got to keep our own safety, and we've got to make sure that in the hospital that these patients survive and can get back home to their families. But I asked in Seattle, which is, you know, it hit first in the state of Washington, and talked with some SEIU nurses out there. I said, when patients get sick and they're on a ventilator, are they living, or is this like a fatal disease? And they said, no, they're living. It's just hard to keep up with the numbers. They're just like, you know, if it's 100 today, tomorrow it's 200, the next day it's 400. You know, it's climbing because we're at the place where we didn't stop it. And now we don't, you know, we're sort of chasing our tails a little bit. But, you know, it's where we are, and we got to go from here, and we've got to, you know, take care of people the best we can. So we're preparing, you know, for a peak where we've ordered more ventilators. We think we have enough nurses. The good news is stuff like ORs and recovery rooms and children's hospital, which we have, nobody's going there electively. So we have, you know, a lot of nurses are not doing what they normally do, but would be ready to help in the ICU and the med-surg and the ED. So we've got about 4,000 nurses at Jackson, and all of them will kind of be repositioned to help with the COVID crisis if we get a peak. So, and I'm sure every other hospital is putting together a very similar plan. Nobody's going in for elective surgery, so all those OR nurses, all those recovery nurses, they're all ready to help be repositioned and help with this fight. So, yeah, it's scary, and it certainly is, you know, really hits home when you lose one of your teammates,
Right.
You know, really brings it home. So everybody's got to stay safe, though. It's not just healthcare workers at risk. Everybody's at risk.
So we're going to take a couple of questions. I forgot to mention this number at the top of the call. If you have a question, feel free to text it to 727-300-9876, 727-300-9876. And we've already had a couple of questions that have already been texted in, and so I'm going to go to the first one. This is from Alberta, who works in Parks and Rec at the City of St. Pete. She said, I'm concerned about the possible exposure to the virus while going out to clean park benches since it lives on surfaces for so long. I do have asthma, but neither doctor will give me a note. Am I at risk? How much at risk am I? Thank you, Alberta.
Okay, Alberta. Well, I guess you're lucky you got an outside job, because back in the, you know, 1800, 1900, when this country had tuberculosis hospitals, they used to open the windows so the air would flow through. That helps immensely to dissipate this virus with the flow of air. So it wouldn't hurt. You're cleaning surfaces of benches and stuff, I would, dump in a little bleach. If you're using soapy water, maybe it's a soap that has a disinfectant in it. Like, believe it or not, Tide laundry soap kills bacteria. There's a few of them. Dial hand soap is a good one that kills bacteria, antibacterial. But the virus is best killed, obviously, with, bleach. So if you're wiping down surfaces, it's not going to be flying around and catch you in the air. It's going to be sitting on a surface, and you got to make sure you don't get it on your, say you sit down on the bench before you clean it. Then you got it on your butt, and then you sit in your car, and then it's on your car seat, and then you lean over on your car seat and put your hand on your car seat. Then it's on your hand. Then you put it on your steering wheel. Then you've got it all over your car. So you want to make sure you clean yourself, wash your hands, wipe the surfaces clean before you sit down. You just got to think about almost everything you touch. Obviously, it's a good idea when people think they're working where the public's been to, leave your shoes outside. Take them off and leave them in your trunk. Whatever, you want to do, don't take your shoes into your house necessarily if you've been, going from park to park to park. Now, I presume the parks are closed, but maybe people are going in anyway. I don't know that they can police that very well, but, because it's open air, it's much safer than in a building. And but I would just encourage you to ask your supervisors if you can have some bleach in the water or something that's a disinfectant. Hope that helps.
Thanks. Our next question is from Mary, who's a paraprofessional at Palm Beach High School. She said, when do we think that we will have a vaccine, and are there any medicines that actually work in the meantime?
Wow. The vaccine, I think, is like a year away, and I'm not real well read on that topic. Some people are taking prophylactic, this anti-malarial drug. I guess it doesn't hurt. One of our docs that works in the trenches in the ED, he's taken it. Our CEO of our hospital, Carlos Magoya, was diagnosed positive. I think he was hanging with the same Brazilian presidents that were here that the city of Miami mayor got exposed to. He's positive but asymptomatic, and somebody's writing him a prescription for this anti-malarial drug. If you know you have it, it might be worth taking it. If you don't have some pre-existing, like asthma, COPD, something, weakness with your lungs or weakness with your heart, your chances are you're going to survive this fine. The people that are most affected, and Sally actually had bad asthma, and the people that have pre-existing conditions, are ones that struggle the hardest with this.
Okay.
I don't know of any other, stay healthy, eat a good diet, sleep a lot, 6 to 8 hours, do all the things that keep you healthy.
So we're going to take our third question, and we're going to go to the next part of the agenda. And this is from Lehman, who's a custodian foreperson with the Palm Beach County School District, and he's also an executive board member. He said, do we have reports of any members with COVID-19? If so, how are we supporting them? Also want to say thanks to all union employees for keeping us informed and providing us with resources. So as I mentioned earlier, Martha, had one of her leaders, one of her members passed as a result of COVID. I think most people on the phone know we've been phone banking and texting and emailing our entire membership and trying to best get an assessment. So far, we haven't had any positive cases that have been reported to us. We have been very lucky in that. We have also been, a FIFA who I think everyone may know, we've been compiling a list of resources, not only through the union, but also through the community that we've been connecting members and their families with around COVID, and we're more than happy to actually circulate those around as well. And so with that, we're going to go to the next part of the agenda, which is about telemedicine service. So I'm going to let Steve, one of the Steves, talk about what is telemedicine, but we have been working on a very ambitious program to deliver member benefits through our credit union, through CDFI work, through other community-based work. One of the things that we know is a big important thing is healthcare, and a lot of our members have been blessed with healthcare because they're working in the public sector. But healthcare costs have been rising; it's still not enough. And now with COVID, people are having to actually stay at home even more. And so they need access to a doctor, and telemedicine is a service that will allow them to be able to access a doctor at home. So with that, I'm actually going to yield the floor to one of the Steves to talk about what is telemedicine, why is telemedicine, its features, costs, the relationship with our local, and everything else. So, Steve?
Great. Hello, everyone. Thank you for being on the call tonight. This is Steve Utley. I'm the CEO of Health Alliance Network. First, I'd like to thank Alfonso and Afifa and that entire team for bringing us into SEIU, FTSU as a benefit to the entire organization. And I can tell you, after listening to Martha talk, if you weren't concerned about COVID-19 before her talk, you will be now, I can tell you that. Health Alliance Network is a telemedicine company. Let me tell you what telemedicine is very briefly. Telemedicine is the use of telecommunications technology and information technologies to provide remote clinical services to patients. Basically, you can talk to a doctor by phone or video. That's what all that words mean. Physicians use telemedicine for the transmission of digital imaging, video, consultation, and remote medical diagnosis. The history of telemedicine dates way back. I won't bore you with that, but just so you know, telemedicine is on the topic of every news desk in America and the world today. So most of us have heard about telemedicine by now. Let's talk a little bit about why you need telemedicine. One of the biggest problems we had, and unanticipated problems that we have with the COVID-19 outbreak, is the overburdening of our healthcare system and our hospitals. About a week ago, I met with some executives from HCA Hospital Group, teleconference with them. I didn't physically meet them. And they anticipated that within 10 days that there would be a 5 to 8 hour wait to get into the emergency room. And it wouldn't necessarily because people had COVID-19. They were concerned they may have COVID-19. Now that has happened, as we can see. If you follow the news, you'll see that's happened in New York, and it's happening in New Jersey. And as it moves further south and southwest of New York and New Jersey, we can expect the same thing to happen throughout the contiguous 48 United States. The government is doing a lot now to protect its citizens from the spread of the virus, but we have to do everything that we can to protect ourselves and those around us and our loved ones from the virus. By using telemedicine, you can pick up your phone and either use a video call like a Skype or FaceTime, or you can use the actual phone to speak with a doctor from anywhere, anytime, 24 hours, 7 days a week. That allows us to relieve the burden on the healthcare system. It allows us to relieve the burden on the hospitals. If we can have more people diagnosed telephonically without having to travel and leave their home and, of course, possibly expose themselves to other viruses, then we can take a lot of pressure off the healthcare system. Now, what SEIU, FTSU has done, they have made arrangements with our company to offer our service to all of its members. Our service is normally available to everyone as a retail customer for $35 a month. Let me tell you what our services are. Our services consist of basically three things. Those three things are unlimited medical use, talk to a doctor, talk to a medical doctor. And our providers, again, are available 24/7 by video or phone. We also have dermatologists on call. You can speak to a dermatologist. You can get a diagnosis from a dermatologist. We have therapists, social workers, and psychiatrists on our plan. Of course, they would be used to eliminate possible anxiety, grief, or loss, any depression, even insomnia. Our three services, medical, dermatology, and behavioral health, are all with no copays. They are all with no per visit fee, and they were all with no deductibles. The special arrangement for the benefit to be offered through the network of SEIU FPSU is this service is less than $15 a month for the entire household. As a member of FPSU, you can purchase the service through their link at $14.99 a month. There's no setup, there's no cancellation charges. It's a month-to-month service, just like a gym membership. It's an incredible opportunity to have immediate access to health care, not only now, but moving forward. Our world is about to change dramatically, even beyond what we've seen in the last 2 months. And telemedicine will be a big part of any health plan moving forward from this day on. With that being said, I'll open the floor for any questions about our service or about telemedicine in general.
Steve, can you define the household, please, for our members? Thank you.
Absolutely. Thank you, Afifa. A household is anyone that's living at that address or has a permanent residency at that address. So if you have a husband and wife and 3 children living at home and maybe a grandparent living in that household at that address, they are included in our $14.99 a month plan. Also, if you have a child away at college, they are also included in the plan because they are actually a permanent member of that address. So that defines our household.
Okay. I have a question from Shatara from the city of Orlando. And she asked the question, okay, if I use this and I need medicine, well, she has 2 questions. If I use this and I need medicine, do I have to go to my existing doctor? And then how does this impact me if I already have insurance through my job?
2 very good questions. Our doctors can diagnose and prescribe as necessary to you with a phone call or video call. If they write a prescription for you, it will be sent to the pharmacy of your choice. Generally speaking, it'll be sent to a pharmacy that's near you. Our app geolocates you, so if you're in Orlando today and Tampa tomorrow, our app will know where you are. The doctor will see the pharmacies around you, and you can select one prior to the call, or you can select a pharmacy during the call, and the prescription will be sent electronically to the pharmacy. We also offer a prescription benefit plan through GoodRx. GoodRx, we're a premium partner with GoodRx, so we get the deepest discounts available for all of our members. And thirdly, the third part of that question was, does it affect my insurance? It does not affect your insurance whatsoever. In fact, it relieves your insurance because there's no burden on your health plan when you use our telemedicine system. So it's separate and apart from your insurance, no burden on your insurance, and your insurance will not be notified that you've actually used our plan.
Steve, just real quick, if they have existing insurance, most of our public sector employers have, other than adjuncts who are on this call also, if they have existing insurance, can they use their insurance to get the prescription medicine?
Absolutely. They can use our insurance as part of, to pay for the prescription that was sent to the pharmacy, or they can check it against our GoodRx program. We have an app that they can check it against. So once you sign up for our service, you can download an app from Apple Store or the Google Play Store, and then you can check the prescription cost against your insurance cost right on our app.
One of the fears that some people have with telemedicine is that maybe the doctors will not be able to diagnose properly. Is there any experience that you guys have with wrong diagnosis and how accurate those diagnoses are?
All of our doctors are U.S. board certified physicians. All of our doctors are licensed in the state where they practice. In other words, where you're located. If you're located in Florida, the doctor would be licensed in the state of Florida to practice. However, there's been a waiver from that in the last 2 weeks. The current administration is now allowing doctors to practice across state lines during this crisis so we can get more doctors available for patients. Now, with the diagnosis, 97% of our calls result in a diagnosis of the patient. In other words, they can tell the patients what's wrong with them. And of that 97%, 73% of those result in a prescription. So not everyone's going to get a prescription unless they need a prescription. One of the things that this works very, very well for is allergies, cold, cough, flu exposure, sore throat, pink eye, sinus infections, skin infections, UTI infections for females, minor injuries. This would be the same as if you go to an urgent care center without an emergency need, a cut or a break or something of that nature. The doctors are exactly the same doctors you're going to see in a primary care facility, in an urgent care, in an ER facility. These doctors are on call on our system 24/7. I believe I answered all your questions, didn't I, Afifa? Was that all of them?
Yeah, that's good, Steve. And also, can you talk to the time, why telemedicine is essential right now, and how can it ease the burden on healthcare systems?
Health Alliance Network was formed in 2017 under a simple premise, and that was to gap the coverage in healthcare and bring affordable healthcare to America and eventually the world. Now, telemedicine is more essential than ever now, particularly with the COVID-19 crisis. If you have a cold, if you have allergy, if you have flu-like symptoms, you absolutely do not want to go into a medical facility and put more pressure on that medical facility than it already has. In addition to that, you don't want to expose yourself to sick people. Let's just say you have allergies, but you think you have a cold or the flu, and you go to a doctor's office or an urgent care or an ER facility. Well, you're going to expose yourself to people that may have the flu and may have a cold or something significant, or even worse, COVID-19. There's no reason to expose yourself to sick people if you don't need to. Telemedicine is the answer, and it is the future of healthcare, and we've been thrown into it. One of our executives that actually I want to thank my executive team. They're all on this call tonight listening in case there's questions that I can't answer. I want to thank them. Steve Sellers, Suhail, and Joe is on the call, and I believe a few other people are on the call too. But our national sales director said in 2017, and it is absolutely true, and he said it's not if you use or have telemedicine, it's when you're going to be on telemedicine, because every person in America will have telemedicine at some point within the next 5 years. Here we are 3 years later with a healthcare crisis, and more people are getting on telemedicine than we ever imagined possible. Every day, more and more groups, more and more individuals are electing to see a doctor by video conference or by telephone, now more than ever.
Steve, thanks. We are excited about the joint work with telemedicine. We've been working on this for 6 months to try to bring this to fruition. Thank you for you being so amenable to the needs of our members. I have another health-related question. If Martha's still on, I wanted to shoot it to her. You still there, Martha?
Yeah.
Okay.
Yep.
So this is from Devin, who's a paramedic at the City of Orlando. And he said, I know for mass testing is used in the hospital, we did fit testing. My concern is that our unit was never fit tested, and we have a large volume of patients, and we go days without knowing who may be a possible source. Do you recommend we continue to use universal masks, or should be delivered or pushing for fit testing? Thanks.
Yeah. The fit testing only needs to happen for those N95, N100s, duckbills, whichever. The regular surgical mask can be worn without fit testing. The only reason they're finding you need an N95 these days, if you're doing in a room with a patient that's COVID positive or high risk or suspected, or to be safe if they have it, if they're intubating the patient or doing some kind of bronchoscopy or something that puts a foreign object in their airway and then stirs up the COVID and causes it to be what they call aerosolized, which just means they make the bacteria or the virus much smaller, and they kind of aerosolize the airway moistures and send it out into the air, and that can drift in the air then and act like it's airborne. So that's when you really want the N95, and you have to be fit tested. If you're going to wear an N95, you should be fit tested. Most often, though, with this virus, wearing a surgical mask is adequate if you're not going to be hanging around, a doctor or an anesthesiologist or a certified nurse anesthetist who's going to be intubating a patient or something. Regular procedures of just walking in a room, hanging in an area that they're positive, the regular mask is fine. And again, go back to the most important thing is the hand washing. And the mask kind of reminds you not to touch your face, and that you have to really, they would have to cough on you within, kind of 3 feet of their cough to get you. And that's what the mask would prevent, that spray of coughing or sneezing from getting to your mouth or nose. And obviously goggles are important if you're around patients who are coughing. And, some people are wearing masks with shields, eye shields, because you don't want something to land in your eye. Hope that helps.
That's very helpful. Thank you. I'm going to just answer a couple of the work-related questions that have popped in. And there's two that they're very similar. One is from Randall, who's a custodian at Lake County Schools, and one is from Candy, who's a survey technician in the city of West Palm Beach. I actually know Candy. The question from Randall is, my doctor told me that with my age at 63 and my underlying health condition, it wouldn't be safe for me to go to work as a custodian. He's going to send me a letter advising my employer of this question. My question is, will I be paid for the time that I missed? And Candy asked the question. She said, my boss said if we come down with the virus, it is on us to use our vacation time. It seems backward to me. I don't want to take this home to my family. Those are really good questions. So the answer I would have is, you both are eligible with the doctor's note to take up to 2 weeks, equal to 80 hours of paid sick leave at the employer's regular rate of pay, where the employee is unable to work because they're quarantined. And that's pursuant to federal, state, or local government order of advice of the healthcare provider. So if you have to be quarantined or you're at risk, you do have the ability to take up to 80 hours, and you shouldn't be docked for that. But to double check, what we're going to do is we're going to look at both of those questions, because all the employers are different. That's based on our conversations with both Lake and the city of West Palm Beach. But we're also going to double check and get you answers to those questions as well. So with that, I want to thank everyone, Steve, Suhail Nanji, Martha Baker. I also want to thank Afifa, Aaron, Joey for putting this together. We're going to be doing these town halls regularly, as we've been doing the past few months. And if you have time, sign up to telemedicine. You're going to get a link. You may have already received the link, but definitely look into it. If you have questions, definitely let us know. And everyone, mostly stay safe. We love you. We'll get through this together. We have a lot of work to do, but we're going to deal with this as a family. So everyone, good night. Take care.